Thanks for staying with us. On Tuesdays, we try to touch on health-related issues also. And join us on the show today to discuss extensively on glaucoma is the Senior Registrar Ophthalmology, Lagos University Teaching Hospital, LUTH, Dr. Ademola Sule. Welcome to the show, sir.
Thank you very much.
Good to have you.
It's my pleasure, it's mine.
So you can join the conversation. You can call us on 081-270-53687, 091-390-7694. You can also tweet to us at TVC Connect, please, hashtag your view TVC, so we can read your tweet. All right, so many people know that glaucoma is one of those diseases of the eye, but many people don't understand the cause. Is it hereditary? Well, what is it exactly? Just to start the conversation, what is glaucoma, and is it hereditary?
Oh, well, thank you for having me. Glaucoma basically is a disease of the optic nerve. The optic nerve connects the eye to the brain. It's responsible for conveying visual information from the eye to the brain. You understand? So what you have in glaucoma is a disease that affects the optic nerve. It's multifactorial. The cause is largely unknown. There's so many causes currently undergoing studies. But basically, there are risk factors that we know are responsible for, that could be responsible for the damages to the optic nerve. So basically, it's multifactorial. It's also said to be a neurodegenerative disease. It's degenerative in nature. And I said it's multifactorial because there are several risk factors that are responsible for this optic nerve damage.
I like to always look at prevention. So, for instance, let's say somebody has glaucoma in the family, maybe one of the parents. How can it be prevented from being transferred to the child?
Well, for prevention, basically, it's not preventable. Glaucoma is basically not preventable because, yes, we have genetics as a risk factor. There are other risk factors responsible for glaucoma. But what is certain about glaucoma is that we can actually prevent visual damage as per the progressive visual loss in patients with glaucoma. But to say to prevent glaucoma as a disease is actually not possible. Although there are studies that are going to ascertain specific causes, and right now there are also different treatment models to see if we could tackle various causes that are responsible for the pathogenesis of glaucoma.
Right. You know, once I went for an eye test abroad, and when they found out I was from Nigeria, the first thing they had to check for was glaucoma, and then they said it is very prevalent in this part of the world. Why is that?
Yes, studies have been done. First of all, glaucoma is a wide spectrum. There are several forms of glaucoma. We need to understand that it's actually very common amongst blacks. Common among blacks, Africans. Nigeria is the most populous nation in Africa, so definitely it's common in Nigeria. Studies have proven it should be common among Africans. It's also noticed to be aggressive among blacks. There's a specific variant, which is the primary open angle glaucoma. There are different variants, different spectrums of glaucoma. The primary open angle glaucoma is common among blacks. And well, we don't have the factors responsible. There are still several studies trying to ascertain why exactly it's common among blacks.
Could it be melanin?
There are so many factors. Yes, melanin is looked into, diet is looked into, genetics generally. Right now, that's the in thing happening right now. People are working on the genes. Could it be genes? Because we know definitely that first-degree relatives of patients with glaucoma have higher chances of having glaucoma. These people are working on currently.
So like most health conditions, I know that if detected early and treated is something that it can be treated. When do you think people should start checking for glaucoma? Like at what point should you get aggressive with checking? And
Yes, the principle of treatment for glaucoma for we ophthalmologists is basically to prevent visual loss. We want to ensure that the progressive nature of the disease is halted. Understand? We don't want it to continue to progressively worsen. So we try to halt the progress. Basically, what is important in management of glaucoma is early diagnosis, early treatment. And because we know that glaucoma is, especially the primary open angle glaucoma, it's usually asymptomatic in the early stages. It becomes symptomatic at the advanced level. And considering the nature of our environment, patients don't present early enough because they don't see the symptoms.
Wow.
So they actually...
What are the symptoms?
Yeah, generally it's for the primary ocular glaucoma specifically, it's asymptomatic. But when it gets to the advanced stage, then we begin to notice that patient begins to have problems with peripheral loss of vision. They notice their visual fields. They begin to lose, vision at the periphery. Then from there, you see it worsens to the extent that they only have a tunnel vision. And at this level, it's advanced. And when they come, there's probably very little we can do. So we have a culture in the environment. People don't present for medical checkups or eye checkups. So
glaucoma works. The price was very high.
If you
it shouldn't be.
If you are diagnosed with glaucoma very early on, and then they give you the eye drops, like my partner, he is supposed to be on eye drops. Is there a certain point that you can stop using the eye drops, or you have to use it for the rest of your life?
Okay, yeah. Glaucoma is actually a chronic disease. It's chronic and it's progressive form of disease. There's no cure, basically. There's no cure. So what we do, like I said earlier, is to prevent further progression of that disease. We don't want you to, and again, it's the commonest cause of irreversible blindness, you understand? The damages done to the optic nerve is irreversible. So when they come in, we are not going to revert to what it was before. We are only going to prevent further loss. Exactly.
Now, does it come with age? Because some people say, is it until somebody is a certain age that they might have glaucoma, or any child or anybody can have glaucoma?
Yes. Like I said, glaucoma is actually a wide spectrum. Right. There are different forms of glaucomas. We have glaucomas found in childhood, although very rare, but we see them very often. But commonly, the one common to us is the primary open-angle glaucoma seen among adults. And we know as you grow older, the chances and the risk of having glaucoma is actually very high. So we actually have a screening module. The American Academy of Ophthalmology has given us a module which says once you are less than 40 years of age, you should probably visit for eye screening, maybe every 5 years. Then once you are above 40 years, you're expected to maybe 2 to 4 times. But because we are blacks and it's very common to us and it's very aggressive, it's advisable you do your screening at least once every year.
Once every year?
Once a year, not once every 2 years?
No, once a year. Because, in fact, it has been reduced to 30 years because of it's very common among us.
I had an eye test last year. So you're saying, like November, you're saying I must do another one
it's
again.
A range. Preferably, it says 2 to 4 years, above 40. Then once it's about...
I'm 61.
61, I expect maybe twice.
I could have been 6 months.
Maybe every 2 years. 2 years.
Every 2 years. Wait, let me go on a break. Come back and continue.
But if you have a family history, every year is preferable.
Let's go on a quick break. When we come back, we continue this conversation. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. We're still discussing glaucoma. And BC had a question for the break. Go ahead, please.
Yes, doctor. So when I hear that something is not curable, I always ask myself, where is the role of the blood of Jesus? Because we have faith and we believe that we can be healed. But on a more serious note, people who have been diagnosed of glaucoma, is there any way that they can manage it? In terms of lifestyle changes, diet. Is there any way?
Like I said earlier, currently there is no cure for glaucoma. What we basically do is we just manage basically the risk factors. Raised intraocular pressure is known to be the known modifiable factor we manage. So we've tried to reduce intraocular pressure and monitor the disease.
What? I didn't get that.
The intraocular pressure, that's the pressure in the eye.
Okay.
So that's what we do most times, is we try to reduce intraocular pressure, monitor the disease. And, well, there are actually other forms of management coming up, although not scientifically proven. Yes. And this new form of management, new form of treatment, try to explore the other forms of causes that are likely to cause glaucoma. Like I said earlier, intraocular pressure is one of the risk factors we know. The other factors like poor blood supplies to the optic nerve. There are factors that have to do with mitochondria.
So there's nothing you can eat, there's nothing you can drink that may just help you?
Well, I would say because the optic nerve is being supplied by blood, and they have vessels supplying it. So the overall well-being of the patient also matters. in determining the healthy nature of the blood vessels that supply the optic nerve. So as much as possible, you need to live healthy. We know that, yes, because of vascular supply to the optic nerve, diabetes, hypertension, they are also risk factors. So as much as possible, you want to ensure you don't have these conditions or you manage these conditions, favorably. So diet, exercises, not rigorous exercises, basically, but exercises,
just
diet,
stay healthy.
Yeah, stay healthy.
Okay.
This will help
Any questions?
the overall.
No questions.
I'm just really worried.
So I was going to talk to Yabo. Good morning, Yabo. Are you there? Hello, Yabo. She's a patient, and she has glaucoma, and I know she wanted to say something. Hello, good morning, are you there? I think we lost her because she was worried about the cost of glaucoma. It's a major factor. That was one of the things she was talking about earlier, that it's quite expensive, not just for the diagnosis, but management.
Yes.
Yeah, so, yeah, for costs, that's why I said earlier, early diagnosis, early treatment. Most of our patients, about 80% of our patients
Hello, Yabo, are you there?
Yes, I am.
Okay, we tried to reach you earlier. Yes. So we hear you have glaucoma. Could you tell us a bit about your condition?
Can you hear me now?
Yes,
Can you hear me now?
Yes, we can.
Good. 23 years back.
Yes. Listen to me, not the TV, please.
Yes,
Please listen to me, not the TV. I think we have to disconnect that because I really wanted to get her story. I mean, she really complained about the cost of maintenance, and now you're addressing that. What I call him.
Yes, I was trying to say, yes, glaucoma is actually a chronic disease, so it requires long-term management and long-term treatment. But with early treatment and early diagnosis and early treatment, the cost over time is probably better compared to when they come in an advanced stage and require more funds. Then also, like I was trying to say, you have the medical form of treatment and the surgical form of treatment. We usually employ our patients, we beg our patients to explore the surgical means, and that over time has helped to reduce the costs of treatments. Yes.
So they could have a surgery done?
Yeah, they can have surgeries done, yes. The surgeries over time would reduce intraocular pressure. Then patients do not necessarily require to buy medications every time. Yes, buying medications sometimes can be difficult. You buy every month, you have to use it for life. But with surgery, it's reducing intraocular pressure very effectively, and over time, reduce the cost of management as well.
Oh, you can do surgery for glaucoma?
Yes, you can do surgery for glaucoma.
Wow, that's good.
And it doesn't have a cure, so the surgery will just reduce it.
Well, the surgery depends on the spectrum, the level of the spectrum, where you are on the spectrum. Where you can, even when it's the low level, you can do surgery, or it's only when it's really, really chronic.
Okay, well, that's usually it's preferable when it's at the early stage. Because what we're trying to do in surgery most times is to reduce intraocular pressure. Filtration surgery is like a bypass surgery. We want to reduce intraocular pressure. We want to, improve the drainage system of the eye. So it's over time you don't require medications. Although once in a while we could have 1-2 drops, but we've noticed from our patients, those who had surgeries spend less.
Traditionalists believe that the body is a sacred place, and once you touch it, like you operate, you have
altered.
Yeah. So that there is no coming back from that. Now, going by what the herbalists think,
obviously,
your one is eye. How am I going to reconcile putting something inside my eye? Because I mean, not that if I was really ill, I would try all options before I cut myself.
You get the point. Because I'm running out of time. I want you to answer this question. So once you enter the place, is it going to ever go back to normal? That what you're saying.
You mean
the eye or the body?
The eye.
Inside the eye. Once you cut inside my eye,
yes.
It's nice.
Before you answer that question, let me take the Yabo back. She's back. Good morning, madam. Are you there?
Yes, good morning, Morayo.
Yes, you were saying earlier before the phone went off.
Yeah. We are, as a glaucoma patient, I'm speaking on behalf of others that we should, the Federal Ministry of Health should help us to see to the high cost of our eye drops. They are very, very expensive. I'm on 3 eye drops now. One, Zalatan, which is glaucoma eye drop, is running for 7,000. And it's a very tiny bottle like this. 7,000. Not to mention the other things. It's better we minimize the rate of blindness, because our eye drops are very, very expensive. We cannot afford buying all these things, and that is also blindness. You know, some other people, because they can't afford it, they go into blindness for life. It's very expensive to maintain our but to manage glaucoma is okay, but to manage blindness is very, very uncomfortable and very, 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 very high. That's just we are appealing to the Federal Ministry of Health, as they did to the HIV patients and to the tuberculosis patients. They are having their medication like free of charge. Let them help us to reduce the cost in maintaining our eye drops.
All right, thank you so much, madam. I think that was the crux of the conversation. The eye drops are so expensive.
Yeah, I think the major issue is most of these medications are imported. Yes, imported. So the dollar exchange has really affected the price.
But it's only got insurance, right? Doesn't insurance cover?
So I think, I just hope the government can come in, give public subsidies,
that's a Mayfield, now.
Give the
What's the Mayfield? I don't understand.
Is he not the one that's running for president?
Like, not running again.
Why can we not let this man drink water and drop
That's all we can take. So thank you so much.
He has made a mistake.
We're going to go on a break. Thank you so much, sir. I think glaucoma, obviously, as you said, is a spectrum, and obviously the maintenance of it is over years, and they can be surgically removed also.
No surgically removed.
No removed.
Surgically treated.
Managed.
Surgically managed, yes.
You never answered my question. When you leave that knife inside my eye.
Yes, ma'am. You'll be fine.
You'll be fine, Waiki.
Last.
I'm actually very concerned. Actually, I'm talking to a herbalist. That's my own concern. We'll talk about that another time. We'll talk about off camera. Stay with us. When we come back, we'll take up another health condition. Stay with us. We'll be right back. Bye.
Stay tuned. Your View will be right back.